Clinical Pathology for Semester 6 of the Faculty of Medicine. Clinical Pathology. Learning objectives: understand the principles of clinical laboratory examinations for diagnosis, monitoring, and prognosis of disease. Be able to interpret laboratory results based on disease pathophysiology. Be able to integrate clinical data with laboratory results in medical decision-making. 1. Introduction to Clinical Pathology. Definition: the science that studies laboratory analysis to help diagnose disease, monitor therapy, and detect health disorders early. Main functions: support disease diagnosis based on laboratory data. Monitor the effectiveness of therapy and disease progression. Determine prognosis or risk of complications. 2. Hematology examination. Complete blood count, CBC, main parameters, hemoglobin, HB, hematocrit, HT, leukocytes, platelets. Result interpretation: anemia, low HB, differentiated based on MCV, mean corpuscular volume. Microcytic, low MCV, iron deficiency anemia. Normocytic, normal MCV, anemia of chronic disease. Macrocytic, high MCV, vitamin B12 or folate deficiency. Leukocytosis, increased leukocytes, indicating bacterial infection or inflammation. Leukopenia, decreased leukocytes, often in viral infections or immunosuppression. Thrombocytopenia, decreased platelets, such as in dengue fever. Peripheral blood smear examination, microscopic examination to see the morphology of blood cells. Example: sickle cells in sickle cell anemia. Blasts in acute leukemia. 3. Clinical biochemistry examination. Liver function profile. Parameters: SGOT, SGPT, total bilirubin, direct bilirubin, albumin. Interpretation: increased SGOT, SGPT, hepatocellular damage. Example: hepatitis. Direct bilirubin increases. Impaired bile excretion, e.g. gallstones. Renal function profile. Parameters: urea, creatinine, GFR. Interpretation: increased creatinine. Acute or chronic renal failure. High urea creatinine ratio, indication of dehydration. Electrolyte profile. Parameters: sodium, potassium, chloride. Interpretation: example: hyperkalemia, renal impairment, metabolic acidosis. Hyponatremia, SIADH, dehydration. Lipid profile. Parameters: total cholesterol, LDL, HDL, triglycerides. Interpretation: increased LDL or triglycerides, right pointing arrow, risk of cardiovascular disease. 4. Clinical microbiology examination. Culture and sensitivity. Identification of microorganisms, bacteria, fungi, from blood, urine, or sputum specimens. Example, blood culture for sepsis. Antibiotic sensitivity test to select optimal therapy. Molecular examination, PCR, detection of pathogen DNA, RNA. Example, PCR for detection of SARS-CoV-2 or HIV. Microscopic examination, gram stain for bacteria, gram-positive, gram-negative. Zeal-Nielsen for Mycobacterium tuberculosis. 5. Immunology and serology examination, antibody examination, IgM, indicates acute infection. IG, indicates long-standing infection or immunity. Example, IgM-IG test for dengue fever diagnosis. Autoimmune examination, ANA, anti-nuclear antibody, for systemic lupus erythematosus. RF, rheumatoid factor, for rheumatoid arthritis. Rapid diagnostic test, antigen or antibody examination for diseases such as malaria, hepatitis. 6. Endocrinology examination, hormone profile, TSH, T3, T4 for thyroid function. Insulin and glucose for diabetes mellitus. Hormone dynamics test, dexamethasone suppression test, for the diagnosis of Cushing's syndrome. ACTH stimulation test, for adrenal insufficiency. 7. Coagulation examination, coagulation parameters. PT, prothrombin time, APTT, activated partial thromboplastin time, INR, international normalized ratio. Coagulation disorders, PT, APTT prolonged. Hemophilia or DIC, disseminated intravascular coagulation. High INR, risk of bleeding in the use of anticoagulants such as warfarin. 8. Body fluid examination, pleural, peritoneal, and joint fluids. Physical examination, color, clarity. Chemical analysis, protein, LDH, glucose. Example, exudate, inflammation, versus transudate, osmotic pressure disturbance. Urinalysis, parameters, protein. Erythrocytes, leukocytes, pH. Interpretation, proteinuria in nephrotic syndrome, hematuria in urinary tract infection. 9. Tumor marker examination, tumor markers, AFP, liver cancer. C. Colorectal cancer, PSA, prostate cancer. Cytology and biopsy, cervical cytology, Pap smear, for cervical cancer. Tissue biopsy for histopathology. 10. Clinical case study. Case 1. Patient with high fever, decreased platelets, right pointing arrow examination. CBC, blood smear, dengue IgM, IG. Case 2. Patient with chest pain, right pointing arrow examination. Lipid profile, troponin, CKMB. Case 3. Patient with jaundice, right pointing arrow examination. Liver function profile, bilirubin. Additional. Table and diagram, normal value table. HB. 12 to 16 gram per deciliter. Female, 14 to 18 grams per deciliter, male. SGOT, SGPT, less than 40 IU, L-creatinine. 0.6 to 1.2 milligram per deciliter. Diagnostic flowchart. Anemia examination flow. Low HB right pointing arrow, MCV right pointing arrow, type of anemia.